Hi, I'm Dr. Carlo Visco. I'm working in Vicenza, Italy. I'm presenting you this study we conducted in the northeast of Italy about patients with mantle cell lymphoma, older patients with mantle cell lymphoma frontline, and first relapsed, studying the combination of rituximab, bendamustine, and cytarabine in this group of patients. As you can see here briefly, we have some in vitro data demonstrating a synergistic effect of the two drugs when combined together on mantle cell lymphoma cell lines. I'm talking about bendamustine and cytarabine. And briefly, the schedule of the R-BAC is first day rituxan at the usual dose, and second and third and fourth day you see there's bendamustine 70 milligrams per square meter, followed 2 hours later by RC 800 milligrams per square meter. The regimen is very well tolerated. We had some concerns about the hematologic toxicity, which is quite high, but it's transient, you see, and regards more thrombocytes than other cytopenias. We had just few episodes of febrile neutropenia. Patients, as you see here, were 20 were previously treated and 20 were relapsed refractory. Here are the lines of prior chemotherapy. 7 were refractory, 7 had the blastoid variant, and MIPI was high in 50% of them. Regarding feasibility, we had 85% of patients that could complete the planned treatment. And if you come here, you can see the response, which was PET guided, meaning that in the 37 evaluable patients so far, the 20 patients first line, 85% had a PET negative CR, which is quite impressive. And here are the Kaplan-Meier curves showing that untreated patients, here's the overall survival, progression-free survival, and duration of response. You see that obviously untreated patients do better. It looks like they maintain the response over time, even though the median follow-up is quite short for mantle cell lymphoma. And as a curiosity, you can see down here the 3 curves showing the behavioral blastoid variants, which look to do badly, and no difference between relapse and refractory. And as you can see here, if they have previous hyperCVAD, they seem to do well anyway.